Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear an ophthalmologist talking to a patient called Joey Root. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Miss Root. You've been referred to me because your doctor suspects you might have a condition called optic neuritis, which affects the optic nerve and can lead to vision problems. I'd like to get a clearer idea of what's been happening. Could you start by telling me about your symptoms?
Sure. It all started about 2 weeks ago. I noticed my vision in my right eye was becoming blurry, almost like a cloud or fog over my eye. At first I thought it was just due to being tired, but it kept getting worse, especially when I'd wake up in the morning.
I see. Was it just the blurriness, or did you notice any other changes?
Well, after the blurriness started, I began having trouble with colours. They looked faded or washed out, especially reds. I'm also feeling some pain behind my eye, mostly when I move it. It's not unbearable, but it's uncomfortable, and the pain seems to get worse when I look up or to the sides.
That's helpful to know. It sounds like we're dealing with some classic symptoms of optic neuritis, especially the blurred vision, pain with eye movement, and color desaturation. Have you had any other issues, such as double vision or flashes of light?
No, I haven't noticed any double vision or flashes. It's mainly just the blurriness and the pain. I'm really worried, though, because my vision hasn't improved at all. And I'm starting to feel anxious about what might happen next.
I understand your concern, especially with something as crucial as vision. We'll work through it together. Have you noticed if anything makes the symptoms worse, like heat or physical activity?
Yes, actually. I forgot to mention, I've noticed that when I get overheated, like after a shower or exercise, the vision in my right eye gets even blurrier. It's scary because it feels like I'm losing sight for a bit.
That's what we call Uthoff's phenomenon, where symptoms of optic neuritis can worsen temporarily with an increase in body temperature. It's not unusual, but it's definitely something to monitor. Have you had any previous episodes of vision problems or anything similar before?
No. This is the first time I've had anything like this. I've always had pretty good eyesight, and nothing like this has ever happened. That's why it's so unsettling.
I understand. Optic neuritis can sometimes appear out of the blue, but it's also important to know that in some cases, it's linked to other conditions, particularly multiple sclerosis, MS, which affects the central nervous system. Have you experienced any other neurological symptoms, such as numbness, tingling, or problems with coordination?
Well, now that you mention it, I have had some occasional tingling in my hands over the last few months, but I didn't think much of it. Could that be related?
It's possible, yes. Tingling and numbness are symptoms that we sometimes see with MS, but it's important not to jump to conclusions. Not everyone with optic neuritis has MS, and there are other conditions that can cause these symptoms as well. We'll need to run a few tests to get a clearer picture.
What kind of tests would that involve?
The first step will be an ophthalmic examination, where I'll look at the optic nerve using special equipment to see if it's swollen or inflamed. Then, we may order an MRI scan to check for any signs of inflammation in the brain and spinal cord, which can help us determine whether there's a link to Ms. Another test we might use is called a visual evoked potential test, which measures how quickly your brain responds to visual stimuli. This can give us more information about how well your optic nerve is functioning.
That sounds like a lot, but I'm willing to do whatever it takes to get to the bottom of this. I just want to understand what's happening to me.
I completely understand, and it's important that we get as much information as possible so we can make an accurate diagnosis. In many cases, optic neuritis improves on its own within a few weeks, but sometimes we need to intervene with treatments like corticosteroids to reduce the inflammation more quickly. Have you been on any medications recently?
No, not really. Just some over-the-counter painkillers for the eye pain, but nothing major.
That's fine. If we confirm optic neuritis and decide on treatment, corticosteroids can help with recovery, but they don't affect long-term outcomes, so we'll also be focusing on any underlying causes. How are you managing your daily activities? Has the vision problem affected your work or other parts of your life?
Yes, it's been really tough. I'm an architect, so I rely heavily on my vision for drawing and designing. Lately, I've had to take time off work because I can't see well enough to do my job, and it's been really frustrating. I feel like I'm stuck in limbo.
Extract 2. Questions 13 to 24. You hear a doctor talking to a patient called Mrs. Sanders. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mrs. Sanders. I understand that you were admitted last night with a suspected case of dengue fever. How are you feeling today?
I'm still feeling quite awful, to be honest. The headache and joint pain are unbearable, and I've been feeling very weak and feverish.
I'm sorry to hear that. Based on what I see here, it seems you were recently traveling. Can you tell me more about that?
Yes, I was in Southeast Asia for about 3 weeks. I got back just over a week ago. I was in Thailand and Cambodia, mostly staying in cities, but also did some trekking through rural areas.
That's helpful to know. Dengue fever is quite common in those regions, especially in areas with a lot of mosquitoes. Did you notice any mosquito bites during your trip?
Yes, I got quite a few, despite using repellent. I didn't think much of it at the time, though.
Unfortunately, mosquitoes are the main carriers of the dengue virus, so it's not uncommon for travelers to contract it even when they're careful. When did your symptoms start?
It was about 4 days after I returned home. At first, I just thought I was exhausted from the trip, but then the fever kicked in, and I started getting these severe headaches and pain behind my eyes. The joint pain came next, and it's been really bad ever since.
The symptoms you're describing are quite typical of dengue fever. The high fever, severe headaches, pain behind the eyes, and joint pain are often referred to as breakbone fever because of how intense the discomfort can be. Have you experienced any nausea, vomiting, or a rash?
Yes, I've had some nausea, though I haven't vomited. And I noticed a rash on my legs and arms a couple of days ago. It started out faint but has become more noticeable.
That rash is another common symptom of dengue fever. It often appears a few days into the illness, alongside the other symptoms. Have you noticed any bleeding, such as from your gums or nose, or bruising more easily than usual?
Actually, yes. I brushed my teeth this morning and my gums bled a little. I thought it was odd because that doesn't normally happen.
That's concerning, but it's something we'll keep a close eye on. Dengue fever can sometimes lead to a more severe form known as dengue hemorrhagic fever, where bleeding and blood clotting issues occur. It's good that you're in the hospital so we can monitor you for any signs of that progression.
That sounds scary. Is it dangerous?
In some cases, yes, it can be serious, but we're here to manage it. The vast majority of dengue cases are mild to moderate, and patients recover fully with supportive care. The key is to stay hydrated and manage the fever and pain. We'll also do regular blood tests to monitor your platelet count, as low platelets can increase the risk of bleeding.
What kind of treatment is there for dengue? Is there any medication that can help?
Unfortunately, there's no specific antiviral treatment for dengue fever itself. We focus on supportive care, which means managing your symptoms. We'll keep you hydrated with intravenous fluids, especially if you're feeling nauseated and unable to drink enough water. For the fever and pain, we'll use paracetamol, but we avoid medications like ibuprofen or aspirin because they can increase the risk of bleeding.
How long will this last? I've already been feeling terrible for days.
Most people recover from dengue within 1 to 2 weeks. The fever usually lasts for 5 to 7 days, but the fatigue and joint pain can linger for a bit longer. Rest is important, and we'll help manage your symptoms as best we can to make you more comfortable during the recovery process.
That's good to know. Is there anything I can do to prevent this from happening again in the future?
The best prevention is avoiding mosquito bites in regions where dengue is common. Wearing long sleeves, using insect repellent, and staying in places with mosquito netting or air conditioning can help. Unfortunately, there isn't a widely available vaccine for dengue in many places, but if you're planning on traveling to dengue endemic areas again, there are some additional measures we can discuss.
I'll definitely be more careful next time. Thank you, Doctor.
You're welcome. We'll continue to monitor you closely while you're here, and if you have any concerns, don't hesitate to let me or the nurses know. We're here to help you get through this.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a doctor explaining about antibiotics. Now read the question.
Now, the good news is that we can treat this with a simple course of antibiotics, so that's what I'll be recommending for now. The antibiotic I'm suggesting is called nitrofurantoin. I'll write that down for you because it's generally well tolerated and it's the #1 choice for treating a urinary tract infection. I hope you don't mind this bit of scrappy paper here. This is 1 tablet, twice a day, for 5 days. For most people, it works well. However, in about 1 in 100 cases, it can cause a bit of nausea, so if you find that you're feeling nauseous, it could be the medication and we might need to switch to something else. We'll come back and talk about that if necessary.
That's okay, that's fine.
Now look at question 26. You hear a medical tech specialist talking to a colleague about the advancements in surgical robots. Now read the question.
The world, and by 2030, the market for these robots is projected to reach around $16 billion. What's really exciting is that these robots are starting to integrate with AI platforms, making surgical decisions more precise and efficient. Think about it, a robot surgeon that operates with the accuracy of a PhD in precision. The potential for improved outcomes is enormous.
Now look at question 27. You hear 2 nurses discussing an article in a nursing journal. Now read the question.
Did you read that article about using telehealth and virtual nursing for stroke patients in the latest nursing journal?
Yes, I found it really promising how virtual interventions could help reduce the workload for inpatient nurses.
Absolutely. But I think many nurses could have predicted that. Virtual nursing has been slowly gaining traction for years.
True, but having solid evidence is essential to push for widespread implementation in hospitals. The study suggests that telehealth could improve patient care and satisfaction, so it's worth pursuing.
I agree. Plus, with many stroke survivors needing long-term care, virtual nursing can make follow-up care more feasible. The article definitely makes a strong case for expanding its use.
Yes, especially since the initial results show it's effective and well received by patients. I just wish they'd included more data on how telehealth impacts stroke rehabilitation outcomes specifically.
Well, there's a link to the full study, so you could dive into those details if you're interested.
Now look at question 28. You hear a medical professional explaining improper disposal of biohazardous materials. Now read the question. Over the past few days, we've noticed an increased concern regarding improper disposal of medical waste and biohazardous materials. This is an issue we need to address immediately, so we'll be reviewing our waste disposal and biohazard handling procedures. I understand that some of you have already received training on this topic, but it's critical to ensure that everyone is up to date and following the correct procedures. First, you should be familiar with the proper segregation of medical waste. This includes separating general waste from hazardous materials and ensuring that sharps are disposed of in puncture-proof containers. Please check the designated bins and sharps containers regularly and replace them when they are full. Secondly, you must always wear the appropriate personal protective equipment, such as gloves, masks, or gowns, when handling biohazardous waste to prevent contamination. After disposing of the waste, ensure that the containers are properly sealed and labeled as biohazardous. Lastly, remember that all waste management practices must comply with environmental and safety regulations. We must follow disposal protocols strictly to avoid any contamination risks. Any questions before we proceed? Now look at question 29. You overhear a conversation between a patient's family member and a nurse regarding end-of-life care. Now read the question.
I can understand how difficult this must be for you. Have you had a chance to speak with the hospice care coordinator?
Yes, but I'm really struggling with this. The doctor told me that hospice is the best option now, but I don't want him to suffer or feel abandoned. I'm not sure if this is the right decision for him. I see him getting weaker every day, and it's breaking my heart.
Have you talked to your father about what he wants during this time? It's important that we consider what will make him feel the most comfortable.
Now look at question 30. You hear a public health specialist giving a presentation about a study he has conducted. Now read the question.
I'm here to discuss a study on improving health literacy and patient education for diverse populations. We focused on patients from various cultural backgrounds who have limited health literacy. Our intervention involved using simplified medical language, visual aids, and culturally tailored materials to explain complex health information. We worked with a group of 60 patients over 6 months. By the end of the study, 85% of the participants showed significant improvement in understanding their treatment plans and following medication instructions. This outcome led to better management of chronic conditions and reduced hospital readmissions. One key insight from this study is that health literacy interventions can have a tremendous impact on patient outcomes, particularly in underserved communities. This research supports expanding similar programs in primary care settings, especially for patients who face language or literacy barriers.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a presentation by a breast cancer nurse specialist named Emily Grant. You now have 90 seconds to read questions.
My name is Emily Grant, and I'm a specialist breast cancer nurse, supporting patients as they navigate the difficult process of being diagnosed and treated for breast cancer. Today, I'd like to share a typical case to highlight what my role entails. Let's focus on one patient in particular, whom I'll call Laura, to demonstrate the various challenges and support mechanisms that come into play when dealing with breast cancer. Before I tell you more about Laura's journey, let me give you some context. Breast cancer remains the most common cancer among women globally. In the UK alone, around 55,000 women are diagnosed annually. Early detection through screening, such as mammograms, plays a key role in improving outcomes. Unfortunately, for many women, receiving a diagnosis can be overwhelming, not just physically but also emotionally, as they struggle to process the information and decisions required. Laura's story began when she went for her routine mammogram at the age of 49. She had always been diligent about her health and had no immediate concerns, but during this appointment a small suspicious area was found. Laura was asked to undergo additional testing, including an ultrasound and a biopsy. Like many women, Laura was shocked because she had no family history of breast cancer and had never experienced any warning signs. When Laura was informed that she had early-stage invasive lobular carcinoma, she felt devastated, although the consultant provided clear explanations of her treatment options. Laura found it hard to come to terms with her diagnosis. She later confided in me that her greatest fear was not the cancer itself, but the changes it might bring to her appearance and overall health, particularly the possibility of losing her hair and feeling exhausted. As a nurse, my role is to offer both practical advice and emotional support. Many patients, like Laura, feel isolated, even when they have a strong support system at home. In Laura's case, she felt burdened by trying to stay strong for her family while concealing her own fears. I encouraged her to join a local breast cancer support group,
where she met others going through similar experiences. Laura's treatment plan included surgery followed by chemotherapy. She underwent a mastectomy, which, while successful in removing the tumor, was a difficult emotional experience for her. Many women struggle with body image after such procedures, and Laura was no different. She was also apprehensive about chemotherapy, fearing the physical toll it would take. In our discussions, we talked about managing side effects like fatigue and nausea, and I provided her with tips on maintaining her well-being during this phase. Throughout the chemotherapy sessions, Laura experienced several of the common side effects, including hair loss and extreme tiredness, but she remained resilient with the support of her healthcare team. One of the things I emphasize to patients is that while the side effects can be difficult, they are temporary, and the goal is always to return to a cancer-free life. After finishing her treatment, Laura was relieved, but also uncertain about what lay ahead. It's common for patients to feel a sense of emptiness after treatment ends, because the routine that has structured their lives suddenly disappears. Laura expressed concern about the possibility of cancer recurrence and struggled to adjust to life after treatment. That's where our follow-up care comes in. We offer regular checkups for patients like Laura and refer them to counseling and rehabilitation programs when needed. Laura found great benefit in attending counseling sessions, where she learned to cope with her fears and rebuild her confidence. Additionally, she joined a rehabilitation program to help regain her physical strength and improve her body image. Laura's journey shows that breast cancer is not just about the physical treatment, it's about addressing the emotional and psychological impacts as well. With survival rates improving, it's essential to provide comprehensive care that supports both the mind and body. Extract 2. Questions 37 to 42. You hear a conversation between a journalist and Dr. Erik Johansson discussing bioprinting. Now, read the questions. You now have 90 seconds to read questions.
Welcome, Dr. Erik Johansson, and thank you for joining us today. We've been hearing a lot about bioprinting in recent years. Can you explain what it is and why it's generating so much excitement in the medical community?
Thank you for having me. Bioprinting is indeed an exciting field. It involves using 3D printing technology to create living tissues using bioinks, which are made from living cells. The ultimate goal is to one day create organs for transplantation, which could solve the critical issue of organ shortages. Right now, thousands of patients are waiting for organs, and many of them don't survive long enough to receive one. With bioprinting, we could theoretically print tissues or even organs on demand, potentially saving countless lives.
That sounds incredible. How exactly does bioprinting work, and how close are we to creating fully functional organs?
The process starts by layering bioinks to build up tissue structures. These bioinks are deposited in precise patterns to form the architecture of the desired tissue. So far, we've had success with simpler tissues like skin and cartilage. However, creating more complex organs, like hearts or kidneys, presents a huge challenge, mainly because of vascularization. This is the process of creating blood vessels that supply nutrients to the tissue. Without a network of vessels, larger tissues or organs can't survive. We're making strides, but we're still several years away from being able to bioprint fully functional organs ready for transplantation.
What are some current applications of bioprinting that are already showing promise?
One of the most promising applications is in wound healing, particularly for burn victims. Traditional skin grafts can be problematic, but bioprinting could allow us to print new skin using the patient's own cells, reducing the risk of rejection and speeding up recovery. Research is moving quickly in this area, and we're already seeing positive results in early trials. Additionally, we're starting to see bioprinting used to create bone and cartilage, which could transform orthopedic surgery. Surgeons might soon have the ability to print custom bone grafts that fit the patient's unique anatomy, reducing complications and improving recovery times.
That's amazing. But what about fully functional organs, like hearts or kidneys? How far away are we from that?
That's the ultimate goal. But creating fully functional organs is much more complicated. It's not just about printing the organ's shape. We also need to recreate its internal structures, including the vascular networks, nerves, and multiple layers of tissue. Researchers are working on solving these issues, and while it's possible that we could print an organ in the near future, it will take time before they're safe and reliable enough for widespread use in clinical settings.
There's a lot of optimism, but are there any ethical concerns that come with bioprinting?
Absolutely, and these concerns are critical to address as we move forward. Access is one of the biggest questions. Will bioprinted organs be available to everyone, or only to those who can afford them? We also have to consider regulation and safety. Bioprinted organs need to be thoroughly tested to ensure they're safe and won't introduce new risks. Then there's the question of long-term performance. Will these organs function as well as donor organs? It's essential that we find ways to make this technology available to all patients while ensuring it meets the highest safety standards.
So, to sum up, bioprinting could revolutionize healthcare, but there's still a long road ahead.
Exactly. Bioprinting has enormous potential to transform medicine. From skin and bone to potentially entire organs, the possibilities are incredible. But as with any breakthrough technology, it requires more research, funding, and careful consideration of the ethical issues before it can be widely used. We're making progress, but we still have a way to go.
That is the end of Part C. You now have 2 minutes to check your answers.